Welcome all the viewers, a health informative talk show hosted by me, your gynecologist, Dr. Pooja Devan. The topic today is a very pertinent topic, menopause. Menopause is a word which brings in a surge of emotions, questions, queries, to some inquisitiveness, to some depression, anxiety, and for some pessimism. I am here today to bust the myths, give you the right information, and address all the questions and solutions which would really come into your mind so that we are armed about the information for menopause. Everything that you want to know about menopause will be shared here. So what is menopause? Meno refers to the menses, that is the menstrual cycle, the periods or the monthly or the chums, whichever name you may like to call it. And it is the cessation or the stoppage of the periods. But does skipping a period or getting delayed period indicate as menopause? No. Menopause is a look back through a retrospective phenomena wherein you have not had your period for one full year. So when you look back and you see that periods have been missing for one full year is when you are declared to have achieved menopause. So what is the phase which is happening when you are having irregular periods, or you may be having periods off and on, less or more, but so many other symptoms? That phase is known as premenopause. And there is so much difficulty which can happen after menopause happens, that is the postmenopausal phase. So there is a term which is known as perimenopause, which includes the time period of almost 4 to 5 years before menopause happens, the actual event of menopause, and the time period of about 3 to 4 years post-menopause. Menopause can also be referred to as the climacteric, but on the whole, the menses have stopped because of hormones. The female hormones, estrogen and progesterone, have plummeted down steeply, and so the ovaries are not functioning and producing the hormone. The egg ability, that is the quantity of eggs in the ovaries, has depleted radically to a near nil, and this is menopause. There is nothing without mathematics here, so let's talk about some numbers. The age of menopause in India is around 47 years of age as an average for a woman. The age worldwide as per WHO, particularly the Western world, is later at 51 years. About 80% of the women who undergo menopause do have symptoms. The symptoms post-menopause can continue on an average for about 4 years, but for some it can be as late as 12 years. Every woman has to have menopause if she has had periods. So this is an omnipresent, universal phenomena for us all as women to embrace. To the surprise of many, menopause can happen much before time. If a woman has complete stoppage of periods before the age of 40, it is termed as early menopause or premature menopause. 1 in 100 women do experience that, and that would be because of premature ovarian failure, which means that the ovaries which are producing the hormone estrogen have shut off. So it's all a game of hormones and the perfect balance of hormones. Estrogen and progesterone are the female hormones, and that's where the catch-22 situation is. These hormones initially fluctuate and then plummet down to a very low level. So what happens? In a woman, there are male hormones as well, like there are female hormones in a male. So the male hormones therefore start exhibiting themselves over and above the depleted estrogen progesterone hormones. The benefits of the hormone estrogen and progesterone, which protects us from the perspective of heart disease and also protects our bones, disappears. Menopause and perimenopause brings with it signs and symptoms, and there are nearly 40 odd of them. To put it simply, period changes are mostly the first indicators. Periods can become heavy, they can become light, They can be skipped, they can be missed, they can get delayed, and they might come early. What I am trying to say is, if your cycle was a 28-day cycle, it could now come at 26 days frequency, or it could come at 35, then 40, then 2 months, then 6 months gap. If you used to bleed for 3 to 5 days, say an average of 5 days, you could now be bleeding around 3 days. You could be bleeding even up to 7-8 days in some situations. Likewise, if you were using many sanitary napkins, say 3 or 4 in a day, you will find that the amount has either decreased or it's become heavy. A change is what you notice first in the ongoing periods. Hot flashes, electric shocks, whatever name you may call it by. But these flashes are experienced by 75% of the women undergoing menopause and can start before the period disturbances happen, alongside or even after the periods have stopped completely. So what exactly are these flashes? It's a feeling of redness and heat and a flush or a gush of blood right into your face, necks, can even be arms and the whole body. Your face can become red. You could burst out into sweat and perspiration. This could happen as much as 3 to 5 times in a day, and for some up to 20 episodes. Many of these experience a cold chill immediately after the flush, and some don't experience a flush but experience only the cold chills. The duration of each of this flush can last about 30 seconds to 5 minutes, but 4 minutes is the average. And this flush experience can go on for years, up to 4 years, and for some even up to 12 to 14 years. That can sound very disappointing, but these flushes can even disturb your sleep, for you may experience a hot flush followed by a chill and complete sweat right in the middle of your sleep, and therefore sleep disturbances also come into play. And not to forget that hot flushes can also be associated with irregular heartbeat, a racy pulse, palpitations, and so it can be a very disturbing phenomenon. And you could often be the odd person out in a gathering where the people think that you are creating a fuss about feeling so hot while you are in a hot flush with sweat all over you, and you are insisting on turning on the knob of the fan and making it faster, or putting the AC at a lower temperature. Amongst the plethora of symptoms are vasomotor symptoms like the hot flushes, chills, perspiration, night sweats that I just shared with you. There are urogenital symptoms, which is affecting the urinary tract and your genital system, which includes getting a burning feeling in your urine, not being able to control your urine when you laugh or cough or sneeze or lift a heavy bucket of water, which is known as stress incontinence. You could also experience dryness in the vagina because you feel that you're not lubricated enough. You could also have low desire for sex, that is, your libido goes down. Your vagina could be dry enough that when you have a sexual intercourse, you feel dryness, burning, pain, irritation, and so you become furthermore averse to a sexual contact. There can be musculoskeletal symptoms, which means you could have vague, non-specific joint pains, aches. There could be abdominal symptoms wherein you feel that your tummy is simply bloated up. I haven't eaten much, but I am getting the bloating. And when you have water or anything, it gets bloated further on. You could be having more of constipation than you ever had before. Don't forget that there are multiple psychological symptoms which also happen. This not just includes anxiety or depression, forgetfulness, lack of concentration, irritability, anger bursts, lack of support from all around, comparative loss of memory, and so on and so forth. But there are also changes in our skin, hair and nails. The skin becomes drier. There are more wrinkles which come in. There is sagging of the skin. The breasts also either sag or get shriveled. The hair becomes drier. There is thinning in the hair. There is hair fall and hair loss. On the face, you could get acne. There could be increased facial hair growth, particularly on the chins or the upper lip or the sides. There could be nail dryness, brittleness, cracks, ridges, and so many of them. Even the ears could get affected, and some of them could have a ringing sensation of tinnitus in the ears. Your skin can burst out into an itchy crawly sensation or a rash. You could feel non-specific tiredness, fatigue. You can even feel dizzy. There can be weight gain. Even the teeth become a little loose sometimes, and there can be bleeding from the gums. Your uterus for sure shrinks in size. The vagina also becomes drier. Let's also talk about the heart and the bones. The heart is protected by the female hormone estrogen. So when the protection goes away, our chances for having strokes and heart attacks increase, and the cholesterol levels can go up and they can stick inside the arteries, blocking the arteries. The bones were always protected by the female hormone estrogen. They can also have thinning in their calcium content and develop osteopenia, that is loss in the bone mass, further on to osteoporosis, and there could be easy fractures which can happen on a little fall or a little impact. In the Pandora's box, there lie more symptoms. There could simply be a change in your body odor. You could have chronic bad breath. You could have burning sensation in your tongue. There could be a little altering in the taste. The breast can become sore. You could feel tense muscles, less energetic, digestive problems, even your allergies can worsen. Menopause can bring with it headaches, migraines, sinus headaches, tension headache. And now add to this the lack of sleep, night sweats, insomnia, and your headaches become worse.